Let's start. So piriform sinus is the one which you are seeing behind and on the either side of the epiglottis. Okay, so which is also called as smuggler's fossa. Okay, so it is going up to pharyngo-epiglottic fold to the upper. This is the pharynx to epiglottis. Pharyngo-epiglottic fold to the esophagus. Pharyngo-epiglottic fold to the esophagus. So these two pockets. Olden days, people used to carry precious diamonds. Okay, so now see here, this laryngopharynx is actually it's a common pathway for air and food. It helps in deglutition and it also provides a vocal tract for resonance of certain speech sounds. Okay. Now coming to the lymphatic drainage, see piriform sinus drains into main lymph nodes. You remember better upper jugular chain of lymph nodes. Okay, parapharyngeal lymph nodes, lateral pharyngeal lymph nodes. 2 to 3 names you remember. Walder's lymphatic ring I told you yesterday. Now you will understand more better in fact. This is nasopharyngeal tonsil, also called as adenoid. This is with auditory tube, tubal tonsil, isn't it? Then we have palatine tonsil. This is palatine tonsil. With the tongue, we have lingual tonsil. So all this is actually ring, mucosa associated lymphatic tissue at the beginning of food and air. I told you it's a line of defense, right? So once we are done with that, Rohita, what did we plan as next essay, beta? ఏం చెప్పుకున్నాం బేటా మనం Yes, where is it situated, beta? So this is the fold of duodenum, what you are seeing. So this is the C fold of duodenum. So within the C fold of duodenum, we have leaf-like organ, which is pancreas. So when you see the structure of pancreas, it has head, it has neck, it has body, and it has tail, isn't it? So this is first part of duodenum, this is second part of duodenum, this is third part of duodenum, and you can see this is fourth part of duodenum. So this is C fold of duodenum, right? Then what are the ducts you are finding coming from the liver? Common bile duct, right? This is the common bile duct. So which joins with the main pancreatic duct to form hepatopancreatic ampulla of water. It opens in the second part of duodenum. We know that. So we will see now, like where is it situated? If you remove some of the abdominal organs like intestines and all, you will see within the C fold of duodenum, you will see pancreas located transversely. This is the transverse location across the posterior abdominal wall. Okay, then. So it is a soft lobulated elongated gland. It has both exocrine and endocrine function. Exocrine part is producing pancreatic juice. Endocrine is producing insulin hormone. Okay. So where is it situated? If you remove the stomach, you are able to see. That means it is behind the stomach and also behind the first part of the duodenum and behind the right, actually in front of the spleen. So this is pancreas. Now we know the 9 regions of abdomen. Hope you remember. See, right hypochondrium, epigastrium, left hypochondrium. Right lumbar, umbilical, left lumbar. Right iliac, hypogastric, left iliac. So like that we have 9 regions. Now pancreas is situated in epigastric and umbilical. This is epigastric region. This is part of umbilical region and left hypochondric region. Okay, this is the location of pancreas in situ. Okay, so that's what is written here. It is lying, see this is our pancreas. When you see the vertebra level, it is situated at the level of L1 and L2 vertebra. Now, pancreas is J-shaped or retort shaped. The length is 12 to 15 centimeters. Breadth is 3 to 4 centimeters. Thickness is 1.5 to 2 centimeters. And the weight of pancreas is 80 grams. Okay, you can see the head, neck, body and tail. Okay, and then different colors are shown. Now, if you just look at this picture, actually this is sagittal section of the body wall, like sagittal section of head and neck you saw in our previous lecture. Now see here you are finding this is our anterior abdominal wall, this is the vertebral column, this is female pelvic region, because how did we identify? We are finding pubic symphysis, urinary bladder, uterus, rectum, anal canal, right? So this is our liver, this is stomach. Extension from the stomach and liver, I told you we have lesser omentum. Extension from the greater curvature of the stomach, this whole area is greater omentum. Area in front of the greater omentum is greater sac. Area behind this is like blue area is lesser sac. Lesser sac, this blue area. Pink area is greater sac. Nobody will ask you greater sac. Area behind the greater and lesser omentum, this blue area is lesser sac. So lesser sac and greater sac will have a whole communication. What is the name of that communication? Epiploic foramen, also called as foramen of Winslow. Behind this lesser sac, now we are talking about this organ. What is this? Pancreas. You will actually come to know like how it is laid out in the body. That means if you remove all these organs, then only you will be able to see pancreas, right? So that means you have to remove the stomach, you have to remove this greater omentum, lesser omentum, liver. Then behind you are able to see the pancreas. Okay. So most of the part of the pancreas is covered by peritoneum. It is retro. What do you mean by retroperitoneal? If you see the organ is situated behind the peritoneum, you usually use the word retroperitoneal. So you are finding this bluish area beta, which is nothing but peritoneal covering. Whatever area is shown in yellow color, those are the areas which are not covered by peritoneum. Okay. If this is required, I will tell you, but otherwise not. Don't want to confuse you with unnecessary details. Now coming to, you have, because it is an essay question, pancreas. Clinical way the question will be framed. I will tell you while discussing applied anatomy. So you have to talk about each part in detail. So this is head, which is enlarged part, which is lying in the C-shaped fold of the duodenum. It has three borders. See, this is upper border, this is lower border, and this is right lateral border. Okay, upper border, lower border, right lateral border. Upper can be also called as superior, inferior, of course. Then front surface is anterior surface. Behind what you see is posterior surface. It is showing this pink projection downwards, which is actually called as uncinate process. In the real cadaver, this is duodenum, C-fold. This is liver, organ big. This leaf-like organ what we have is pancreas. Okay, this is kidney. This is abdominal aorta, inferior vena cava, and blood vessels. Now, this is our head, which is large in C-shaped fold of the duodenum, which is situated at the level of L1, L2 vertebra. It has anterior surface related to transverse colon and coils of intestines, anterior relations. If you remove this head, behind we will see inferior vena cava, right crus of diaphragm, bile duct. Okay, then. So what are the borders I told you? It has upper border, lower, right and left. All the borders are related to duodenum except for the left border. Now if you see, you will understand more. This exclusively is head beta. So at the upper border, you have an artery. You call it as superior pancreatico-duodenal artery. At the lower part of the head also, you are finding an artery. You call it as inferior pancreatico-duodenal artery. This is the right border where you are finding anastomosis of superior and inferior pancreatico-duodenal artery. Okay. When you see the inside view of this right lateral border, you will see hepatopancreatic ampulla will be opening in the second part of duodenum. Okay, anterior surface, this one related to duodenum, transverse colon, jejunum and all. Okay, stomach is also present anteriorly. This is our lesser omentum. Area behind this lesser omentum and greater omentum behind, if you remove the stomach, that blue area what I have shown in sagittal section, that is lesser sac. What is this hole, red in color? Epiploic foramen, where arrow is shown, which communicates the greater sac and lesser sac. This picture we also study when we do stomach bed. That means within the stomach bed, that means it is forming the posterior relation of the stomach. So if you remove the head, what are the structures we see behind that forms the posterior relations of the head? So you will see it is related to inferior vena cava. It is related to right and right renal veins, and also the left renal veins. Okay, this is right crest of the diaphragm. We also see bile duct. Okay, so this whole thing is head, and this projection is uncinate process. Anteriorly, this uncinate process is related to superior mesenteric vessels. If you remove this uncinate process, behind we have aorta, above we will have left renal vein. So many relations you will have better. And just behind the head we have neck. So neck also will have upper border and lower border. Upper border is related to first part of duodenum. Lower border is related to transverse mesocolon. Okay. Anteriorly the neck is related to peritoneum and lesser sac pylorus of the stomach. Posterior surface of the neck, it is related to superior mesenteric vein, which will join with the splenic vein to form portal vein. Portal vein we will see at the neck of the pancreas. Very important this is. Neck is related to portal vein. And now coming to the body. So it's an elongated part. It will have upper border, it will have lower border, it will have the middle border in the middle actually, which will be shelf like. It is 3D picture in fact. So body extends from the, like I told you, it is 3D, triangular in cross section. It has upper border is superior, lower border is inferior. In front we have anterior border. So now between those you will have three surfaces. Behind is posterior surface, and like we have one inferior surface below and one surface is facing above, which is called as anterior surface. 3D picture it is. Okay, this is upper border, this is lower border. Okay, then you will have one anterior border. Between the anterior and upper border you will have this anterior surface. Between the inferior and the anterior border we will have inferior surface. If you see from behind we will have posterior surface. Okay, so body will have one projection here upwards. That projection is actually called as tuber omentale or omental tuberosity. Okay, at the superior border we will see little towards neck. Okay, here somewhere. Now coming to the relations, so now borders, anterior border, this was in the middle I said, right? It is giving attachment to root of transverse mesocolon. Superior border, this is our superior border. It is related to celiac trunk. This is our hepatic artery, and this is our splenic artery going to the spleen. This is inferior border. So inferior border is related to this artery, which was also with this uncinate process. No, what is the name of this artery? Superior mesenteric artery. Surfaces of the body. It has anterior surface, it has inferior surface and posterior. So anterior is covered with peritoneum, lesser sac stomach. Posteriorly, it is related to duodenojejunal flexure, coils of jejunum, left colic flexure. So posteriorly, that means you have removed pancreas. What we are finding, obviously, we are finding left renal vein, left renal artery, left kidney, left crus of diaphragm, abdominal aorta, psoas major muscle, right, left ureter, okay, left gonadal vein, like that. So if you understand picture, you can write in your own words. You have removed pancreas here. So it is related to aorta, left crus of diaphragm, left psoas major muscle, left sympathetic chain, left kidney, left suprarenal gland, left renal vessels. Whatever I told you, everything is here. There is some question here. I'm not finding question in the chat box, beta. Can you please? I'm not even finding the student's name. Tell me orally, I'm here only. I can clarify your doubt. Did you delete it? I'm not finding any question. Was it Kurram? Niharika? Okay.
Yes, ma'am.
Yeah, yeah.
I was asking
Yes.
whether I should remember the whole gross
No,
anatomy
it
of
is essay
pancreas,
question,
ma'am.
beta. You should remember everything. Actually, that's
Okay.
why it is little complicated. Though it looks interesting, highly volatile subject this is. Of course, beta, you should remember everything beta. Here I can't give you any choice. Okay, all everything which is being taught you read from your textbook, diagrams are given, practice those diagrams, try to remember because probable essay question this is. Okay, so tail is the narrow terminal part. Yes, feel free, but all of us are in the same boat. Don't hesitate how much to remember, how much to study. Of course you have every right to know because less time, more to study, isn't it? Okay. So tail is also related anteriorly to stomach, posteriorly it is related to spleen, below it is related to left colic flexure. Okay. So when you just cut the section of pancreas, inside the pancreas we have ducts. Exocrine part is secreting enzymes. No, this is all entering into the ducts. We have one main pancreatic duct. We have one accessory pancreatic duct. This is all main with wider lumen. Narrow one is accessory pancreatic duct. This is main pancreatic duct, which is also called as a duct of Wirsel, okay, which is having around 3 mm in diameter. Okay, it begins in the tail and then it is coming like this, and it shows herring fish pattern, fish bone pattern. It is okay. It is receiving so many small ducts. It joins with the bile duct to open into the second part of the duodenum. Okay, herring fish. This is okay. So this is our main pancreatic duct. We know it joins from the liver. We have bile duct. Both of them will join to form hepatopancreatic ampulla. This point I told you when we were discussing extrahepatic biliary apparatus, when we were discussing liver, we are discussing pancreas also. Finally, at the major duodenal papilla, you will see the opening of the major pancreatic duct. Okay. So this is, if you just measure from the pyloric end of the stomach, the major duodenal papilla is opening 8 to 10 centimeters distal to pylorus. Okay, this is our duodenum, second part. Bile duct, pancreatic duct, these are the sphincters. Okay, this is the major duodenal papilla. Okay, above you have minor duodenal papilla also for accessory pancreatic duct. This is accessory. Accessory is opening with minor duodenal papilla. It's also called as duct of Santorini. Okay, this one. So the real dissected specimen looks like this. Pancreas, piecemeal dissection if you do, this is our main pancreatic duct. Okay. So now coming to blood supply of pancreas. If you remember the head at the upper border, we found superior pancreatico-duodenal artery. At the lower border, inferior pancreatico-duodenal artery. Same thing you will have. Superior pancreatico-duodenal here and inferior pancreatico-duodenal. Actually, part of the pancreas is supplied by branches of celiac trunk. Part of it is supplied by the branches of superior mesenteric artery. Basically, in the gut we have three arteries: foregut, midgut, hindgut. Foregut artery is celiac trunk, midgut artery is superior mesenteric artery, hindgut artery is inferior mesenteric artery. Because pancreas develops both from foregut, midgut, it has branches from celiac trunk and superior mesenteric artery. Okay. Same thing, many slides are there. That's why I'm just skipping unnecessary details. So what is the vein we have, beta? Neck of the pancreas, I asked you. Remember it very well, portal vein. How is it formed? Superior mesenteric vein joins with splenic vein to form portal vein. Okay, just write that much is more than enough. Okay, nerve supply always for abdominal organs. You remember this nerve, vagus. Parasympathetic is always vagus. Sympathetic is celiac plexus, superior mesenteric plexus. Enough. Remaining details I don't recommend. Unnecessarily, I don't want to trouble you. Yes, lymphatic drainage. Nearby lymph nodes. What are the major lymph nodes we will have? Pancreatico-duodenal group of lymph nodes, pancreatico-splenic lymph nodes, celiac and superior mesenteric lymph nodes. Okay. These three names you try to remember. Just a minute. This I will explain you nicely when we do. If we are done with maximum gross topics, whenever you want, I will start embryology now. Because I'm finding almost topics are done only. Whenever you want, we will do embryology as complete. Exclusively embryology, 2 to 3 days if I take, it will be done. Okay. So Steve Jobs, he actually died with pancreatic tumor, beta. So this is one clinical condition where you have annular pancreas, trauma of pancreas, inflammation of pancreas. See, this is basically if there is any inflammation of pancreas, usually we find in alcoholism, there will be pain which is referred to epigastrium. Okay, clinical condition may look as it is mumps also. So in acute pancreatitis, you will see there may be some discoloration in the anterior abdominal wall also. So there carcinoma is nothing but if you are finding like size of the gland is increasing. Okay, patient may present with obstructive jaundice because of the compression of that common bile duct. Ascites may be there due to compression of portal vein. There may be pyloric obstruction also. Okay, so there is one technique which you should know, like endoscopic retrograde cholangiopancreaticography, ERCP, endoscopic retrograde cholangiopancreatography. What does it mean? Through the endoscope, we are able to see cholangio in the sense extrahepatic biliary apparatus, and also we are able to see pancreas. So that is the technique which helps us to visualize the pancreas and extrahepatic biliary apparatus. ERCP, you can remember. And we know endocrine part of pancreas, if they are not working, it will lead to diabetes mellitus, ME, not ME. Histology of pancreas, we have lot of acini. Acini are all glandular cells, and apart from the acini, we have islets of Langerhans, where we have collection of alpha, beta, and delta cells. Beta cells are for insulin, alpha cells are for glucagon, delta cells are for somatostatin. Okay, alpha glucagon, beta insulin, delta somatostatin. Okay, F pancreatic polypeptide. Okay, these are islets, endocrine, islets of Langerhans. Okay, so that is all about pancreas. Mm, what is the next question you want me to discuss better?